Hey, our Navy students, doing so many videos today. I'm getting confused what class I'm in. So we're going to go over some more of the heart today. Kind of did an introduction with you on the first day of notes. Just general size and depth and width and things like that. Today I'm going to kind of focus on the coverings of the heart. And when we dissect the heart, you'll see some of these things. The covering of the heart is kind of interesting. The heart is encased in a sac called the pericardium. And it's actually an interesting sac. It's got two parts. The outside is very fibrous, very tough, very strong. And the inside is lined with a moist lining called a serous portion. Okay. And it's a kind of an interesting, think of it like a grocery sack. So your heart sits in this sack. You get those brown paper groceries bags at the store. That's the fibrous pericardium. It sits in there and it just kind of beats in this loose fitting inelastic sac. So the sac just sits there. It does not expand. In fact, you have to cut it with a scalpel to get it off. I don't know if our hearts, sometimes I get hearts with it on, sometimes they're off. But it's very, very tough, very durable, which it has to be because it has to be on there the rest of your life, right? And then the inside, it's got this moist lining, and the reason for that is it's very similar to putting oil in a car to keep the things running smoothly, to take away friction so the heat doesn't damage the inside of a car motor. That's the same principle. We don't want to damage the inside of our heart because that's obviously going to cause some issues. So it's kind of a different one. Most people think it's this wrapped around her like saran wrap and it just beats with the heart. But in actuality, it's like a grocery sack and the heart just beats within it. All right. Now, some things that are really important with this these linings. Okay. So that's the outside sac. And then there's a lining that inside of the fibrous pericardium is called the parietal layer. And so that's that serous lining on the loose sac. But then the heart itself has a lining like saran wrap called a visceral layer. That's called the epicardium, which means outside the heart. And it adheres right to the heart itself. So when the heart has this glistening, shiny look to it, that's actually this visceral layer. Okay. And there's actually a space between the visceral and the parietal. So the inside of the loose sac, the parietal, okay, and then right on the heart itself, the visceral, there's a space and there's a few drops of pericardial fluid. So as that heart beats in that loose fitting sac, again, that's taking away the heat, is keeping us from getting our heart damaged. And it's basically a very nice system. Now, sometimes, unfortunately, we have some issues with it. So we have this well-lubricated lining. It does a good job, and for most of us, we never have any issues with it. But it can come, your heart can get infection in it. So one thing we really worry about, there's some viruses that can attack the heart. And we have this condition we call the pericarditis. It's called pericarditis. And sometimes the pericardium gets inflamed, and that can be due to pus, unclotted blood protein called fibrin. And basically, we don't want to, and just notice I got the word inflamed misspelled. I'll have to fix that. But that's going to hinder your pumping ability. Okay, so if you get pus, swelling, irritation, just like we have a sore joint in the body, get inflammation in the elbow or the knee or the ankle. We know what that's like. Really bad in the heart, because what happens is sometimes the visceral and parietal layers will start to stick together, and we don't have that space, and that fluid kind of gets squished out of there. Good science word. And now we have some issues, and it can progress. Pericarditis, we can get antibiotics in a person, we can get the inflammation out, and most people are fine. If it turns into something called cardiac tamponade, that hampers the pumping efficiency of the heart, and that's a very, very serious situation. And in really severe cases, you got to take that out. You got to remove that because the heart has to be able to beat. Okay. I actually have an uncle that when he was in his 30s, now he's in his 70s, so he's had this for 40 plus years, but almost 50. But he was in a very serious car accident. A car actually hit him in the driver's side door while he ran a stop sign, and it bruised his heart. Sorry for that interruption there. Good old PA. But he was in that serious car accident, and it literally bruised his heart. You don't think of the heart getting bruised. You think of a bruise on your arm, your leg, or something like that. But he actually got his heart bruised, and he had such a bad pericarditis and cardiac tamponade, they literally took the pericardial sac off. So he has a heart that doesn't have that lining, and it hasn't seemed to affect him. He does all the normal things, but they don't want to do that. The sac's there for a reason. But in serious situations, if they don't have another option, that's what they do. Or, this sounds kind of nasty too, they'll stick a needle down in there very carefully and suck some of that fluid off. But man, you got to be really careful with that process because obviously you don't want to stick a needle into the heart. That would be really bad. Okay, so that's pretty much how the linings work. And what's going on with my slideshow, but let's see if we can show you a really quick video on some of that, and then we'll go from there, if this works. All right.
Hi, this is Dr. Ren Hartung at Glen Oaks Community College. For this video, I'm showing a normal pig's heart. You can see a nice normal surface to this pig's heart. The epicardium is nice and smooth and slick. And then this other pig heart, which I got from the same meat processing business the other day, this one obviously has a problem. There's fibrotic tissue on the outside of the heart. This little piggy had some kind of pericarditis, an inflammation of the outside of the heart. There's the back side. So you can see these kind of fibers. I thought maybe we'd take a look and see if there were any differences on the inside as well. So I'm going to section both of these hearts using what I like to call my Friday the 13th knife. Here's the normal heart, endocardium, myocardium, epicardium, left ventricle, left atrium, and so on. And then just in case there's a difference, let's open up the diseased heart. And I do not see any obvious gross abnormalities. So it looks like the inside of this pig's heart was not affected, but obviously the outside of the heart was affected by the inflammation.
All right, so you can kind of see, we don't need to go, I'm not going to use the Friday the 13th knife. That looks a little bit crazy out. We'll use a scalpel when we dissect. But you can see the difference between the two hearts. And those linings are really important. So that's why we're very cautious with viral infections that attack the heart and bacterial infections. There's lots of things that can affect the heart and its function. All right. Okay, hopefully that makes sense. We're going to get into the inside parts of the heart tomorrow, and we will dissect the heart either virtually or in lab, and we'll see all the chambers and the blood vessels, and we'll kind of get into some of that. And then we'll wrap up notes with talking about the physiology, the electrical parts of the heart, and things like that. Okay, hopefully that makes sense. As always, go Chargers. No, just kidding. It's not like Mr. Skimmerhorn on the PA. But as always, if you got questions, shoot me an email. All right, hey, have a great day. We'll talk to you later. See you. Bye.